Hello, everybody. As you're just starting to come in, thank you for being here. It's Facebook Live time, YouTube time. It's cat time with Dr. Sarah Wooten. Hi. As you guys come in, I'm so happy that you're spending some of your beautiful day with me. Happy Tuesday, by the way. 2/22/22. It's an auspicious day. So thank you for spending part of your Tuesday with me. I'm Dr. Sarah Wooten, and I am just going to kind of do a little bit of housekeeping items as people start to trickle in. It always takes like a minute or two. So, first things first, I am a small animal veterinarian. Yes, I am. Look, there's my plaque. Here's my jacket. Graduated from UC Davis, practiced for 16 years. And now I mostly just help people like you. So, yes, this hour is dedicated to you and your questions. So, it says over here in the title, Ask a Vet Anything. And it's true. You can ask me anything you want. I cannot promise that I will have the answers to every single question that you ask. However, I will do my best. Just a caveat, couple of caveats, couple of things. Okay. One, I am way better with health topics, anything that has to do with health, than I am with behavior. I do have some behavioral training, but the bulk of my training is as a doctor, right? So I'm not necessarily a cat psychologist. I can help you out a little bit, but maybe not as much as a behaviorist. Okay. Second thing, this hour, as educational and awesome and as inspiring and whatever it is going to be, because this is dependent on what you guys ask me, is for educational purposes only. Okay. I am just a veterinarian hanging out on the social medias now for an hour, and I am not your vet, right? So I cannot give you actual advice. I can just talk to you as I would talk to a friend, right? Or if I was talking to a client, this is what I would say. However, this should not and does not substitute for the actual advice that you get from a local veterinarian that you've signed up for and paid for their services, right? Educational purposes only. Okay. So, another thing, if you want your question answered, it's best to get it into the chat as soon as possible. As we get rolling on this, the chat window tends to get really full really fast. And I have yet to make it to the end of my question list to date. So if you have something you want me to answer, get it in there as soon as possible, because there's a higher likelihood I will see it and then get you the information that you're looking for. All right. Lastly, there was a question 2 times ago. I think December was when it was. Is that this was a recorded thing and it wasn't live, and I actually was not here. So last time I dispelled that rumor. Again, see, it says Restream right there. That's just the service that I'm using because it helps me access multiple platforms at the same time. Okay, I'm actually here, guys. I am actually really live here. I would show you my phone, but it just didn't translate very well last time. Okay, so enough about me. We are going to get into your questions. So, hello, cat time. Woo, hello, chum. Hello, Matt Kimmerline. Hello, Natasha Golobardova. Beautiful. Okay. So, first question coming in from Olivia. How do you treat or prevent gingivitis in cats? Great question. So, couple of things. There's a couple of different causes of gingivitis in cats, right? So, first things first, gingivitis is an inflamed gum tissue. So, all of this right here, those are your gums. It's the gingiva is the official medical term that we actually use. And when it gets inflamed, when anything gets inflamed, it gets an itis after it, right? So gingivitis, right? Periodontitis. Anytime you see an itis, all that means is inflammation. Okay. So in cats, gingivitis has a couple of main causes. We'll go over 2 of them here. Number one, the one that's harder to treat and prevent is any gingivitis that's associated with viral infections. So when kittens are young, they're often exposed to everything. Sometimes there is a kitten that has something funky with their immune system where they develop gingivitis and it's due to underlying viruses. Those you can do everything you can to boost their immune system, maintain your excellent oral health, and then talk to your veterinarian about supplements that can actually boost the immune system to reduce symptoms associated with gingivitis that is a viral component. Secondly, we're actually going to talk about three. The second one is something called gingivitis stomatitis in cats that we think is an autoimmune disorder that has something to do with the cat's, for lack of a better explanation, sometimes we say genetics, right? There's something about that cat's immune system, could be a viral component, we don't know, that causes them to attack their own teeth in their mouth. It's very, very painful. And it leads to a lot of inflammation. The cats that have this particular situation, they have very red and inflamed gums. I mean, it is fire engine red in there all the time. And so the only treatment for those cats, unfortunately, because they are literally having an allergy to their own teeth. I know it sounds weird, I know, but the only treatment that we have come up with is total mouth extractions. Take all the teeth out, all the gingivitis goes away, right? It works. And then people are like, oh my God, what my cat is going to eat? Well, I've seen cats, once they're healed up from that surgery, they will eat canned food. Some of them, and I don't know how, will still eat dry food. I don't know how, but they eat just fine and they feel great after. The third type of gingivitis is just caused by plaque and bacteria that are building up on the teeth. And that turns into tartar, what we call calculus. And then that leads to a trapping of infection along the gum line. So how do you treat that? Well, once it's hardened to tartar, there's nothing you can do to get it off. It takes about 3 days for plaque, the white stuff that accumulates on the teeth, to turn into tartar in just about any species, cats, dogs, humans, all of us, right? So once it's turned into tartar, the only way to get it off is scraping, and that's done by a professional. So if there is gingivitis in place and there is tartar in place, the only thing you can do is get it professionally cleaned by a veterinary professional. Okay. If you just have plaque, the soft white stuff, you can brush that off. So the ways to prevent it in cats are home dental care. So training those cats when they're really young to have their teeth brushed. Yes, it is possible. Don't stick your fingers inside. You have to go around the outside. Check on YouTube. There is a ton of videos out there teaching you how to do that. Okay. Other ways to do that, dental wipes. Some people get a dental wipe, they wipe that around the finger and then do that. There are dental rinses, dental additives, dental chews, dental diets. I know that Science Diet makes TD and several of the other brands make different diets that are all designed to reduce plaque. Okay, so those are the ways to prevent it. Hopefully that answers your question, my friend. Okay. Hi, Nana. How are you? Okay. Here is an interesting question. Fluffy ragdoll. Interesting question. Is there a way to cure pyometra in cats besides surgery? If so, what meds do you recommend? Okay. Now remember, this is for educational purposes only, friends. Okay. But pyometra is basically the official medical term for an infection in the uterus of any animal, right? And so in this case, we're talking about cats. So there's a couple of different types of pyometra. There is an open pyometra. This is probably way more information than you guys are looking for, but here we go. Open pyometra, where the cervix is open, so any of the infection that is in the uterus can drain out. Then there is closed pyometra, where the cervix is closed and the infection just stays in the uterus and builds up. And basically what it causes, I'm sorry, this is going to be gross, so we probably should have a TVMA rating on this, but here we go. What happens is it builds up pus inside of the uterus. And what happens is the uterus only has so much space in there. And once it's built up to a certain point, if it's a closed pyometra, that uterus can actually rupture, and that is life-threatening. Pyometra in itself is life-threatening anyways, because it's a severe infection. Having said that, there are sometimes some breeding animals that do get a pyometra of some sorts. If it is open pyometra, I have seen people go in and try and save the uterus because it's a valuable breeding animal by treating it with antibiotics. Okay. So, and I'm not going to say which ones because it's different for everybody, right? But the risk with that is that once a uterus in a cat or any animal, right, has had a pyometra, it's at high risk to have it happen again. So, generally speaking, our treatment recommendation is to spay that animal, and that is with surgery. That's the surgery to take everything out. Having said that, have been some cases I have seen where they have been treated with antibiotics. Maybe there was another litter that needed to come through, something like that. Very, very individualized cases. So great question. Hopefully that answers. Again, as far as which medications, it's just antibiotics, and it's depending on what type of bacteria is causing the infection. Okay. All right. Again, happy Tuesday. This is a very cool day. I love it. Okay. Let's see what we've got. Oh, thank you so much for your question, Abby. Hello. Nice to meet you. Thank you for asking. Hi, my cat is 12 pounds now with a round belly. Live in multi-cat household. How can I help her to lose weight? She's small except for her belly, of course. Thank you so much. Well, couple of things with that. One, you want to make sure that the distension in the abdomen is due to fat and not something else. People can get confused sometimes because they think that their animal is fat when it turns out that there might be some sort of enlarged organ in the belly. Now, I don't know if that's what's going on in your case, but it's important to make sure that you get that ruled out first because you have to, because sometimes there's a tumor that's causing the abdominal enlargement. Other times there can just be fluid that's in the belly. So heart disease can cause a backup in the fluid because heart disease causes the heart pump to not pump as well. And so fluid backs up, and abdominal distension is one of those signs. Another thing that can cause a big rounded belly in a kitty is something called Cushing's disease, which is a hormonal condition. And that causes them to have a big pot belly because their adrenal glands are making too much cortisol. So there's several different medical conditions that can cause abdominal distension that it's important to make sure that your cat's not dealing with one of those. So first things first, if you haven't already, if you get a physical examination on your cat to make sure that that's exactly what you're dealing with. Second, if you've already done that and it's just fat, okay, great. So if you are wanting to help her lose weight, I highly recommend finding out what her ideal weight is supposed to be. So if she's 12 pounds, is her ideal weight supposed to be 10 pounds, 9 pounds, 11? I don't know. So I would also talk to a veterinarian and make sure you find out what that weight is. Then once you have that, then you need to feed the cat for that weight. A lot of people, when they're trying to get their cat to lose weight, make one of two mistakes. They feed their cat, they look at the bag, they look at the label on the bag, and then they feed their cat the amount that is recommended for the weight they are at now. That's not going to help you get anywhere because that's enough calories to maintain them at their current weight. Or the other mistake is that they reduce the calories too much too soon, and then that can make the cat really sick. That actually causes fatty liver syndrome. So you do not want to restrict too many calories on a cat. When they lose weight, it needs to be gradual. So find out what her ideal weight is. Find out exactly how many calories you're supposed to be feeding per day. Ask your vet how much that is in the current food that you're feeding, right? And you want it in cups. And even better, okay, here's the real secret. Ask them for how much to feed in grams, and then get a gram scale and weigh that amount out. It's Weight Watchers for cats, right? And that is a more accurate way because the cup, it works, but it's inaccurate. And then expect your cat to get down to their goal weight within 3 to 6 months. It takes time. It takes time for the weight to come on. It takes time for it to come back off. All right. So be patient and then check your weight as you go. If your cat, the other thing you could ask your veterinarian about is if they recommend another food out there that would help facilitate quicker weight loss. There are some amazing therapeutic diets out there that I have used in practice for my patients that are remarkable at helping animals lose weight. And again, no endorsements here, but one of the ones that I really found a lot of benefit from was the metabolic diet from Hills. Yes, I know that there's a lot of controversy surrounding big kibble, but it's a really great diet and it's saved some animals' life. So look into a prescription weight loss food or therapeutic food. Lastly, if you're in a multi-cat household, you're going to have to make sure that your chunker, your oh Lord, she's coming, is not getting into the other cat's food. So there's some ways to do that. One of the best ways I've seen is people get a big plastic tub, then they cut a hole in it that is big enough to let the skinny cats in, but not big enough to let the fat cat in. And then they put the food for the other cats in that plastic tub. Okay. Other options are there are feeders that have specific, like a color, tags that come with them that the feeder will only open when that tag comes out, or that feeder will only put out a certain amount of food for you can program it. So a lot of great tools out there. See if that will help you. Okay. Oh, my Emily Webb. Emily Webb, hello, my friend. Of course, you're going to ask me about nutrition. Yeah, okay, so let's get this question going, all right? So before I talk about nutrition, friends, I have to say that I am one veterinarian on a planet of 8 billion people. I am one little point of view, okay? So if you don't agree with my point of view, that's totally fine, okay? But this is just my little thing here, all right? What do I think about grain-free diets? Well, having worked with several pet food manufacturers and done a rotation in nutrition and then practiced for all these years and seen how animals do on different diets that are out there, I think mostly that they are just marketing hype. So let me tell you why. Because there's really no regulation around the term grain-free diet, okay? And there's a lot of variety of what these pet foods will use instead of grains, okay? So there you could be feeding something that has peas in it. You could be feeding something that has sweet potatoes in it. You could be feeding something that has fill in the blank, something else, right? There's lots of different things out there. So there's no regulation. And I feel like there was a big push towards it several years ago, and consumers really like the idea of the ancestral diet, blah, blah, blah. But when it comes down to it, there's a lot of just marketing hype around it and just deciding, what are the consumers wanting, and then let's give it to them, not considering exactly what the pets need or want, which I think is most important. So there's no regulation around it. Also, several years ago now, maybe 2019, 2018, excuse me, there was a lot of concern that some grain-free diets in dogs were actually causing heart disease in dogs. So currently the FDA has a list of diets that were implicated, and they've had several summits and meetings and have come to the conclusion that they don't know whether grain-free diets are causing heart disease, dilated cardiomyopathy in dogs or not. They're not going to put forth any regulation on it. They're just going to continue to study it and see what happens. Okay. Having said that, that's not an issue in cats, at least at this time. Okay. Other things to consider. Cats are obligate carnivores, right? They use meat, they use protein for energy. So they do need protein, right? So what are we doing feeding cats carbohydrates? So if you are feeding a grain-free kibble to a cat, you're still feeding carbohydrates to that cat. You're not feeding just, protein to that cat, because in order to make kibble, they have to have some sort of carb, starch, something to keep the kibble like in a shape, right? You can't cook protein and keep it in that shape. So instead of just using grains, the ones that are most familiar are out there: oatmeal, um, grain, wheat, corn. Those are the big ones, right? They're just using alternative ones. So it's still a starch, it's just a different starch. So I would say grain free to me just is mostly marketing hype. I don't have the end all be all on the nutrition recommendations. I have seen cats eat grain free diets and do great. I have seen them eat other commercial foods and do great. I have seen them eat raw and do great. So it is an individual choice. I just really want you guys to understand that most of the stuff you see on the front of a bag is just marketing. There are no regulations around terms like natural or holistic or any of that stuff. There are regulations around complete and balanced for all life stages. Organic has regulations. There are no regulations around grain free. What do I say regulations? I mean the AAFCO regulations, AAFCO, at least here in the United States. Outside of the states, not sure. Those are different regulations. But those mean that the diets have been tested and meet a certain requirement in order to get that AAFCO labeling on them. All right. So hopefully that answers your question. Probably, again, more than you want to know. Okay, so Sarah Corona, hello, my friend. Your 4-month-old kitty just got neutered yesterday. Oh my gosh, you're probably playing nursemaid to your kitten today. Hopefully, you're taking good care and he's not getting too crazy and he's staying quiet like he's supposed to. Okay, let's see. Who do we have? Mark Kimmerling liked and shared to my Facebook. Well, thank you, darling. That's wonderful. Thank you so much. Oh, so Lemon chimed in on the neutering from Sarah for isn't 4 months old a little too early for neutering? Actually, I mean it's a tiny bit earlier than we tend to neuter cats. We tend to neuter them between 5 and 6 months of age, but 4 months is okay. If we were having a discussion about dogs, this would be totally different. But we're talking about cats, and you can have them neutered at 4 months of age. Okay. Here is a question from my friend Juan Kim. Hello, Dr. Sarah. Hi, my friend. My cat had diarrhea last week and he's okay now. So that must mean that the poop's back to normal, which is great. But he refuses to eat the wet food he used to love. Could he be associating the food with being sick? Should I try giving him a new food? Great questions. Awesome. Okay, so answer to your first question, yes. Cats build up very strong food preferences. And if they are nauseous and then they go to eat something, they will definitely build that association in their brain. Okay, so definitely could be a thing there. Should I try giving him a new food? Potentially. So I would recommend, since he just had diarrhea, if I was talking to a friend for educational purposes only, I would actually say potentially change the food to something new, but not yet. So when a cat has diarrhea, that is very hard on their intestines, and their intestines need time to heal. Intestines heal pretty fast, but sometimes it takes 10 to 14 days for all of those intestinal cells to get back to normal. And if you switch them to a new food now, you may risk causing more stomach upset. So what I would be doing right now is I would be feeding, if it was my cat, I would be feeding a bland food, either boiled chicken and rice for a homemade diet, or there are tons and tons of therapeutic diets out there that are designed to be highly digestible and low fat, right? We want very low fat and easily digested, very bland, and that allows the intestines to heal. And I would continue feeding that for like another week, maybe two. And then I would get a new canned food and I would mix it with the bland food. And I would take about a week to transition to a new diet, to a new canned food, and then watch for any kind of upset in the meantime. So that's probably your best case moving forward. And then maybe in 6 months or so, you can try the old food again that your cat really liked. And if they eat it, great. If they don't, great. There's tons of other foods out there. Okay. Okay, let's see. Okay, here's another question about weight loss. Thank you guys for asking about weight loss, by the way. One of my biggest challenges in practice is getting people to feed their cats appropriate amounts of food because we see a ton of obesity, at least here in the States. And so the fact that you guys are asking questions about this, you are like dream clients, your dream pet parents. I love you. Okay. So here is D. What do you see better results in cats losing weight? Freeze-dried healthier food or a prescription diet? Cat is 12 and going for 10 pounds, but can't seem to get him to just eat wet food. Well, and that's again because cats will develop very strong food preferences. And in fact, some cats not only love certain flavors, they love certain shapes, triangles, circles, stars. They love it, right? And so it's if a cat's been eating that for a long time, it can be very challenging to get them to switch. So in practice, I tended to see the best results with the clients that I worked with on a regular basis. So if I saw your cat and I was like, we need to get 3 pounds off of this cat, we would design a weight loss program with managing our expectations for the weight loss, managing the amount of calories per day, and then also increasing exercise. So for me, I tend to like the therapeutic, and this is again just me, my friends, just me. I tend to like the therapeutic weight loss foods because they are supplemented with L-carnitine. Love that stuff. And they are designed to be able to reduce the amount of calories without causing nutrient imbalances in other things. What do I mean by other things? Amino acids, vitamins, minerals. A lot of things that people don't understand is when they put a cat on a diet, right? A weight loss diet, and they just keep feeding the same food, but they reduce the amount of food that they're feeding, they're actually throwing their cat into a nutritional imbalance because that food is designed to provide all those nutrients for the weight that it is maintaining. It's not designed to get the cat to lose weight. So I really like the therapeutic weight loss diets for the cats that I was working with. And then it's important to just follow up, right? Because if you aren't losing the weight, then we have to do some detective work to find out why. Having said that, I have also worked with clients who prefer to use the freeze dried or the raw, and they have their recipes formulated by a nutritionist. Um, I support that as well. So I have seen results good with both. This is an individual choice that you guys are making. The only thing I would caution you against is if you need your cat to lose weight, make sure they're eating some sort of weight loss food if you're feeding commercial food, because again, we don't want to throw them into imbalances with amino acids, vitamins, minerals, fiber, things like that, right? It's not just all about the calories. There's a lot going on there. Okay. All right. D, thank you for saying thank you. Thank you. Okay. How much should here is a question, don't, DVD. How much should a 10-month-old cat weigh? Depends. So at 10 months of age, the cat should be fully grown. So they should be done growing. So you, depending on what breed you think your cat is, you need to go to the breed standard page. So just, Google, even for like, as far as like a domestic short hair, like your standard cat. Here's my cat, right? I would say anywhere between 7 to 10 pounds, depending on the breed. If it's a Maine Coon, it's probably gonna be closer to 12, maybe 13. Some of them maybe 15, right? These cats are huge. So go to the breed standard page, look up what it says for what you think your breed is, and that is your goal weight, because and that at 10 months of age should be an adult. Okay. For most cats, 8 months old, I would say between 7 to 10 pounds. Okay. All right. Uh, Hold on. I accidentally starred something instead of showing it. Okay, that worked. If my kitten is 6 pounds, can he eat half a can of wet food 3 times a day along with dry food? Thank you, Sarah. I love your name. You have a great name. Okay, so great question. I'm going to go back to my standard recommendations. So, for example, there are awesome calorie calculators on the internet. Just Google pet food calculator. All right. And then that is a calculator that you can use to put in your cat's weight, to put in the amount of calories that your food has, and then to tell you how much that you can feed of each. So, in general, a 6 pound cat probably should be eating like 250 kcals per day. Kcal just means kilocalorie. So, if you look on your can, it's going to be in really tiny writing, or you can go to the website to look up the product information. And you want to find out how many kilocalories per can there is. Okay. So in a lot of cans, they might have like 300 calories total in the whole can. Then you need to find out how many kilocalories per cup is in the dry food. Okay. And then you can decide what percentage you want to feed of canned and of dry, but it shouldn't add up to more than around 250 to 275 kilocalories per day. Okay. So you're going to have to do some math. You're going to have to look at what it says on the cans and on the bags of food. And then you're going to have to decide how much. But if you want to feed half canned and half dry per day, go for it. Go for it. Just make sure to not exceed your daily caloric requirement. Okay. That's the hardest thing. And that's, I think, a really important point that I need to bring home, that it doesn't matter what you're feeding, you need to make sure that daily calorie requirement stays at or below what you're supposed to be feeding. For a 8 to 10 pound cat, it's like 300 to 330 kcals per day. For a Maine Coon, which are like beasts, big beasts, I mean, it's closer to maybe 400 a day. Okay. But again, you're going to have to do a little bit of math. So hopefully that helps you, my friend. Okay. Wow. We are really, really into weight questions today. Here's a different question. Okay. D, I love you. So, what is my preferred cat litter? I don't have a particular brand that I like more than others. But what I do notice that cats tend to prefer is fine, sandy, clumping, unscented litter. Again, fine, sandy, clumping, unscented litter. They don't like scented litter. So that's what I find that they tend to really like. Here is one from Scott. How often should one brush cat's teeth? Thank you for asking about dental care. So, considering that it takes about 72 hours for plaque, the white stuff that you can get off with brushing, to turn into tartar, which is the hard stuff that has to be chipped off by a professional. If you can brush your cat's teeth every other day, you are a champion. If you can brush your cat's teeth every day, you are going to get bonus points in cat heaven. If you need to go every 3 days or twice a week because your schedule is crazy and maybe you have 3 children and a full-time job and you're got a lot going on, that's better than nothing. But if you go every other day, if you go every 2 days, that's the best. Or every day. That is amazing. And a lot of people tend to forget it. So I put a reminder on the phone, or you can also just make it your daily routine. When you're brushing your teeth, your cat's getting their teeth brushed too, right? Okay. Oops. Let me see if I can. Okay. So, okay. Here is Kiara, beautiful name. My cat is getting scabs on her nose. What could cause this? So that often is a mosquito allergy. So they're getting little mosquito bites on their nose is a typical that can be that. I had a cat growing up that every spring, it's not spring now, it's winter, she would get a little scabs because it was a mosquito allergy. Another thing could be something called squamous cell could be like precancerous lesions. So just like us, cats can get skin cancer and they can have different levels of skin cancer. They can have like the precancerous lesions, then they can have the full blown lesions. Uh, Squamous cell carcinoma is the type of skin cancer. It's mostly seen in cats that have white skin around their, or pink skin, white hair, pink skin around their tips of their noses or on the tips of their ears are the most common places. So if you're seeing those little scabs, I would make sure to get them checked out that they are not that. If they are, the good news is you can have them removed just like in humans, okay? Okay. Janet, you are a champion of cat love here. Wow, 5 rescue cats. Any tips on fight prevention? Okay, hold on. I do. All right. So, a couple of things. Remember, just like foster children, cats, foster cats, rescue cats can come with emotional baggage, can be challenging. Also, not all cats are extroverts. Some of them are introverts. Some of them are ambiverts. Some of them don't want to be around other cats. Some of them love other cats. So, first of all, make sure they are all spayed and neutered because male cats will fight. Female cats that aren't spayed will get pregnant. So, we want to have them spayed and neutered. Secondly, make sure that they all have enough space to get away from each other. You need like 300 square feet per cat, pretty sure. And that they all have their own set of resources. What do I mean by resources? Their own food and water bowls, their own bedding, their own scratch material, own toys, own litter box. 3, make sure you have 6 litter boxes because behaviorists recommend having one more box the number of cats to prevent litter box drama. All right. So that's the next one. Make sure that your cats that are more introverted have a way to get away from the cats that are more, okay? Then you can use calming aids. I would check in to see if Feliway helps you if you haven't used that already. It's a feline calming pheromone, and it can often bring a sense of calm and peace to a household that is having some stress. Then the other thing is if you have some cats that are more rambunctious and tend to be the instigators, play with those cats a lot. If you have a certain time of day when the fights tend to happen, make sure to separate the cats during that time of day. Some people have issues with their cats fighting at night, so they have to separate their cats at night. Maybe if you have one instigator it could be that you have a cat that doesn't like being around other cats, and that's just not ever going to be a thing. So instead of trying to, give prescription medications or all of this stuff, do what's best for the cat. If you have a cat that just does not get along with other cats, maybe that cat is better off in a single cat household. So hopefully those are some things to get you started. As far as like remote punishment or like spraying them when they fight or shaking a can or anything, I mean, it will, or throwing it. So if there is a big cat fight, you can toss a pillow at them to kind of surprise them and separate. But that may, if that continues to be a problem, I don't recommend remote punishment because it can often escalate the issue. Also, it's important to find out what is causing the fighting. Is there another cat in the house, in the neighborhood that comes around? Maybe a feral cat is spraying and inciting your cats to elevated levels of aggression. How is your stress level? Cats can pick up on our stress level, and then they can redirect that to other animals as well. So there's a lot going on. I do recommend speaking with a behaviorist because remember, I told you, I am a doctor here, not a cat psychologist. So hopefully that will get you some things to get you started. Lemon, can a cat pee after seeing a mouse? Yes. It could be yes. The answer is yes. But it could be that mouse could cause that cat to want to urine mark. Yeah. So that could be going on. Thank you for asking the question. Oh, I already did that. All right. Okay. Here's a question about from Lori. My 3-month old, hi, thank you for asking questions. My 3-month old tabby kitten was with diarrhea for about 3 weeks straight. Now a little better with diet change, and the excrement study went good, so no parasites. But I don't know what could have happened. Yeah, those are sometimes tough. So the thing with the parasites is they don't always show themselves when you're testing. And one of the common ones that we see in young kittens like yours is coccidia. Which is a protozoa. It's a single-celled organism, and it can tend to cause some diarrhea in cats and dogs as well. But sometimes you don't find it because it just doesn't show up in the poop. Oftentimes, when I saw those, I would still treat for coccidia when I was practicing. Another possibility is was it around any vaccinations? Because vaccines, I don't know if they're in your cat right now. They should be because your cat's the right age for that. Sometimes a vaccination can actually cause differences in gut flora or inflammation, which can lead to diarrhea in some animals. So that's also a possibility. As far as like food allergies, probably not. If you think about it, it takes a while for an allergy to show up because the immune system has to be repeatedly exposed to the same allergen in order to mount a immune response, which is the allergy. But what could be is there is food sensitivities or adverse food reactions. Make sure that you check the recalls to see if there was any recalls on your pet food because aflatoxins, which come from mold or spoiled food, can also cause diarrhea. But good for you on getting your kitten tested, and I am glad that things are going better. Okay, stick with okay. Rapture ready. Rapture ready. You ready to go? Okay. Is it normal to have my help my kitten clean her rear end sometimes? Thanks. Yeah, definitely. So just with all behaviors, it takes a little bit. Oh, I apologize. Keep getting the spam risk. It takes a little time for some kittens to develop their behaviors. And some kittens, if they weren't taught by a mother kitten, if they were orphaned when they were young, they can take a little bit longer because they didn't have anybody to model the behavior for them. So, yes, it is normal. If it continues as the kitten gets older, say 6 months of age, 8 months of age, then I would talk to a veterinarian and see if there's anything else going on. Okay. Okay. Hello, my friend, Miss Cat. We're doing a lot of nutrition stuff today. When my cat eats wet food, I tried a wet diet for about 6 months. He has wet poops. So now I have to do dry food and wet food as treats sometimes. I wish I could do wet all the time since it's healthy. I think that's actually a common misconception. So I love canned food. I think that it's high in protein and it's high in moisture, both of things that our cats need. However, there's a lot of good benefits with dry food as well. And I don't necessarily think one is better than the other. I think a combination of both is great. So if it seems like that particular canned food was causing your cat to have some yucky poo, then I wouldn't use that brand anymore. And I would switch to something different and then continue to do it as the treats. And then slowly, and I mean slowly, over a period of weeks, try to increase the amount of canned food that you're feeding per day and then see how the poops go. If the poops get yucky again, then dial it back. Could be that your cat needs the fiber that is in dry food, and in which case that's totally fine. Um, and then the other thing is if you are still noticing problems, always get a poop sample checked out by a veterinarian just to make sure that there's no parasites going on. Uh, and the cool thing, I know you guys are going to say this. I know you're sitting there going, I can't even get into the vet. Oh, I know that's an issue right now. But one of the cool things about poop samples is that you could potentially just drop off the poop sample at the vet clinic and ask them to run a fecal test for parasites. And they can do that. And they can do that without having to see the cat, right? And we do it all the time. I had people drop off poop samples all the time. And then if we do see parasites or we see a problem, we can schedule an appointment for the cat. But sometimes it's nice to just get that fecal exam done to give you a little peace of mind. And you don't always have to take the cat with you to the vet hospital. Okay, that's a little insider trick there. Deep Strike, hi. Hi, AAC family. Hello. Oh, this is a great question. Okay. And I love the way that it's asked. Space Catboy. You get the prize for best name today. Can we deal with male cats' clogged wieners without buying the $80 a bag CD food? Okay. Well, it depends. Maybe. Okay. So there are other, so yes. So if your cat is, it depends on why it's getting clogged. Okay. There is actually surgery that you can have done, just so you guys know that this is available. It's called a perineal urethrostomy. And it's basically where they take the urethra and they make a new hole. They kind of make a boy cat into a girl cat, for lack of a better word of saying it. And that is one way to surgically fix the problem. Other things that you could try if you are not wanting to try that therapeutic diet anymore is you could try moving to just more of a canned food. Again, what we're thinking about is trying to keep the urine pH balanced, free of crystals that cause stones that can clog up the wiener, as you put it. And then keep that urine nice and dilute. Okay, so you may want to look at other types of therapeutic diets that may not be as expensive. So ask your veterinary provider if there's something else that you can try. Also, go to them with this specific question, because I would say, for educational purposes only, sure, we could try moving to a canned diet and just try feeding canned food and then check the urine maybe once a month and have you watch the cat really closely for any signs of getting clogged again. It's your cat. You can do what you want with your cat. So there are options, but again, it's really important to work with a veterinarian that you trust. And if you're hitting a dead end with that vet, they're like, no, this is it. This is the only thing. Well, it's time to get a second opinion, because there are lots of opinions, even in veterinary world. So yes, there are options. Am I going to go into all of them right now? Probably not, because this is for educational purposes only. But I can tell you, yeah, it's time to have a conversation. Okay. Hmm. Okay, Nana, my cat is 4.5 months, and every time before going to her litter box, she makes some sounds. And I think you might have meant to write, and she's healthy. Maybe it should be, but she's healthy. Should I be concerned about the sounds? Well, I don't know. So if I was seeing you, I would say it depends on what those sounds are. Can you please take a video and show them to me? Okay, because that will help me have a better idea of what kind of mood or behaviors your cat is in before they go. right? If your cat is making the sounds while they're in the litter box, then that could indicate some pain, either with the urinary tract or the gastrointestinal tract. And then that's worth an investigation. So I would say get a video, email it to your vet and say, hey, my cat does this. Is this normal? And if your vet's like most vets out there, which we are, tend to be very kind-hearted, open-hearted, generous, giving, loving people, we're also a little neurotic and perfectionistic, but don't hold that against us, okay? We'll look at it and give you a quick, yeah, that's fine, or no, you should come bring that cat in. Okay, so that's what I would do. Here is a great question. Rachel, from a vet's perspective, do you find that pet health insurance is worth it? Yeah, yes, I do. And let me tell you why. So, especially for a cat, health insurance is not very expensive. Maybe $30 a month, maybe for some of the older ones, maybe 50, maybe. Um, what I have found practicing is that when there is a and the thing is these health insurance policies are fairly small because the overall cost of veterinary care as compared to human medical care is very, very low. Yes, it's still sticker shock to all of you guys. I totally get it. But if you could have a knee surgery done for $4,000 on a dog versus how much that would cost in a human, 20,000, 30,000, I don't even know, then it's cost effective. So most of the policies are fairly small. Also, these cats, dogs, they don't tend to live as long, so they can keep the premium levels low. I can tell you that, and it's also a reimbursement. So people, except for a couple of companies which directly reimburse the veterinarian. So I can tell you that when there's a health insurance policy in place, I feel mm, I feel relieved. And let me tell you why. Because having discussions about money is one of the things that stress veterinarians out more than anything. We hate it. We hate it. We want to hug all the kittens and fix all the things, and we want to practice our best medicine all the time. Unfortunately, veterinary medicine is still a cash business, right? And so it adds this additional stress where I'm like, well, is the client going to go for this treatment? Are they going to go for the blood work? Are they going to go for the surgery? I don't know. What do I know that is best for the pet? I know what that is. But then there's this whole money discussion on top of it, right? So it not only it gives me a sigh of relief because I can go, oh, I can just practice medicine the way I want to, and I can provide the best care. The other thing that I've noticed with my clients that have pet health insurance, they seem less stressed because they don't have that, can I afford to pay for it hanging over their head? And I feel so bad for people when they not only are worried about this family member being sick, which is enough in itself, but then they got the stress of the money on top of it. You guys go through a lot, right? So as a vet, I like it. But again, remember, I am one point of view in 8 billion people. So that's just me. Okay, let's see. I already did the $80 bag. Okay, hold on. Okay, looks like you guys are helping each other out, so that's awesome. All right, Miss Cat 24, you're doing a good job feeding your cats. Juliet says, sorry, a behavioral question. Thank you. Well, let me do my best. Let's see what we can do here, okay? And you don't have to apologize. Okay, I've had my cat for 18 months, adopted him at 10 months of age. He is very loving, but a real biter. Hold on, I can't see that. Tablets, no good. Tablets. Okay, so well, I would say, when do you find him biting you? What are the triggers to him going into biting? Is it just petting? Is it playing? Is it something else? Because what you're going to need to do is identify the trigger, and you're going to need to avoid it for a while. Because that is something that's an association he's built in his little cat brain, that this happens and then I bite. Okay. So if it's just petting, maybe you're going to need to figure out the parts of his body that you can pet without him going into bite mode. It could be that he's just feeling really playful. Cats bite when they're feeling playful. So maybe he needs increased exercise and mental stimulation and a lot more just, play that's not anything to do with your fingers, other toys. So that could be that. As far as when he starts to do it, if you are like maybe engaged in a petting, like you're petting, then that is your cue to get up and walk away. Anytime he engages in the behavior that you don't want, all you do is you get up and you walk away. You stop the engagement. And then beyond that, that would be where I would start. Okay. So that's where I would start. Okay. This chat is option. Thank you, Rapture Ready. I really appreciate that. Does deferminate Okay, here's a question about brushes. Does deferminator type of brushes are safe for cats? I would say yes. They're rakes. So they're rakes that are designed to remove all the dead hair off of an animal, dog, cat. So if your cat has mats, though, they're not good for that because they're just going to pull the skin. You really need to either have those mats clipped out or you will need to have like a little tiny comb to tease those out. Okay. All right. Oh man, you guys are killing me with these nutrition questions. But here I am. I'm doing my best. How can you transition to a raw food diet? Well, first of all, you want to have a recipe that is formulated. So you either want to buy commercial raw products that have the AFCO statement on them that says complete and balanced for all life stages. Okay. So make sure. So if you're buying commercial products, make sure that statement is on it. Otherwise, it will say things like complete and balanced for growth and lactation. That's for nursing moms and kittens. Or it will say for supplemental feeding only. And what that means is it's not complete and balanced and should not be fed as a solo diet because it will lead to nutritional imbalances. Okay. So make sure you're getting something that's a commercial product that is AFCO certified, complete and balanced for all life stages. If you want to do your own recipes, then you need to book a consult with a board certified nutritionist. They do them over the phone, they do Zoom, and they will create a recipe for you that you can then follow. And the reason being is because if you don't balance the food correctly, then you can lead to deficiencies, amino acids, vitamins, minerals, fiber, things like that. As far as the actual transition, you want to go slow. So you want to stick with what you're feeding now and then slowly transition over, I would say about 10 days to the new food. What do I mean by that? So like the first day, you're going to do 9/10 of the old food and 1/10 of the new food. Then the next day, 2/10 of the 1/5, basically, and then so on and so forth until you have fully transitioned over. If at any time you notice vomiting, loss of appetite, or diarrhea, you step back and go slower. Okay. If you see it again, that diet's probably not going to be a good fit with your animal. Go back to the drawing board. Okay. Also, this may go without saying, but practice safe food handling techniques. What I have found is most people that feed raw are amazing at like their level of knowledge and their level of investment. They know that it's more expensive. They know that it takes time. They've done their research. But make sure they use safe food handling techniques because raw food does present different challenges. And I'm thinking about bacteria. Okay, quick one for Hillary, because I feel like we've covered this already. Should cats be on dry, wet, or both dry and wet food? Both. I like both. Okay, that's the end. If you can only do one or the other, that's all you can do. Guys, how did an hour go by? How did an hour go by? Oh my Lord. So I see I see so many questions in here that I have not answered, so I'm going to do one more here. Hillary, my cat had red blood in her urine, but the vet could not find any infection, crystals, or stones. It did find she was constipated. Could this have affected her bladder? Yes, absolutely, but maybe not in the way that you are thinking. What you are describing to me sounds like FIC, feline interstitial cystitis, which is a stress. It's inflammation of the bladder wall that's caused by stress. Could constipation cause stress that could then cause FIC? Absolutely. Pain anywhere in the body can cause FIC. So, again, feline interstitial cystitis. It is a stress induced bladder condition, very similar to the ones that we find in women. Go to some veterinary websites and read up onto it. It sounds like what your cat needs. Again, this is for educational purposes only, is some stress management. Okay. Okay, my friends. So here is the deal. I have run out of time. And I wish I could sit on here for 5 hours and answer every single question because you lovely people, it's actually a highlight of my month to come in and be able to answer these questions for you. So, to all of you who are still here with me right now, I appreciate you so much. And I appreciate the care and concern you are bringing to the responsibility that you're bringing to your pet guardianship. And I appreciate this ability to interact with you on this level. So, I wish I was a veterinarian for each and every one of you. But in the meantime, I hope that you learned a couple of things that might help you to take better care of your cat. So if you have more information that you want to get, then you need to hop on over to the All About Cats website because they have a forum where you can ask questions. I've seen veterinary professionals hanging out there. They can answer your questions. And in the meantime, I will be back next month, last Tuesday of the month at 2 p.m. Mountain Standard Time, which is where I am right now. So if you didn't get your question answered this time, come back next time, pop on as soon as you can and get that question in at the top because I never make it through. So thank you again so much, so much love to all of you. And I will see you again